Hello, everybody. My name is Swati Maan, and I'm a dentist. What is bleeding gums to you? I mean, does that scare you? So I'm just going to explain you what are the most common causes of the bleeding of gums and some information about how serious the situation can be. The most common cause of the bleeding gums is the plaque entrapment, which means the buildup of plaque and tartar around the margins of your gums from the food and the drinks that we have every day. We do brush our teeth thoroughly, but there are some hidden areas of our mouth where the plaque can be entrapped, especially in between your teeth, at the back surface of your teeth, which is quite inaccessible by your brush and can generally lead to the plaque formation, which can lead to the bacteria formation, bad bacteria formation, and leading to the bleeding of gums. The bleeding happens because there is some ongoing inflammation or infection. So if you recently started to see some bleeding while you brush your teeth, it's always good to book yourself for a thorough scale and polish. In general as well, we advise the patients to have a scale and polish every 6 months so all the areas of your teeth are cleaned properly. If you ignore this first stage of gum inflammation, this can lead to more serious problem, what we call as a periodontitis, which means the infection or inflammation, which is now just confined to the outer surface of your gum, is now reaching to the deeper tissues of your teeth and can lead to the mobility of your teeth, some bad breath, sensitivity, spontaneous bleeding, etc. At this stage, the treatment will be more serious and you might need a referral to a periodontist who is the specialist of the gum health. This is for the oral hygiene, but sometimes some deficiencies in the body is also associated with the bleeding of gums, what we call the vitamin C deficiency. Like it said, the pirates suffer from the bleeding gums is because they didn't have access to the fresh fruits and vegetables. So if you see that your oral health is pretty okay, your dentist is saying your oral hygiene is great, but you still have bleeding gums, it's always good to check your vitamin C levels and make sure that that is up to the mark. Sometimes it's also associated with the hormonal changes, especially during pregnancy or menopause. These things require a bit of an extra care and make sure again you visit your dentist and your hygienist. Mostly the hormonal changes during pregnancy, and if you have bleeding gums because of that, that rectifies or it just heals itself on its own as soon as you have delivered the baby and the hormones are back to normal. Another reason could be associated with some medications that is taken for blood pressure or epilepsy or some other medical issues. So if you recently started to have any medications and you noticed any bleeding of gums with the intake of that medication, then of course it's important to speak to your medical practitioner or your dental practitioners. Not to scare you, but sometimes the bleeding of gums is more serious. So if none of the above things are relatable to you and you still have bleeding of gums, it could be also associated with the blood sugar level, diabetes, or it could also be associated with leukemia or HIV or any other health issues. So all I want to say is we should not take the bleeding of gums very lightly. And it's always important that if you see consistent, the flow of blood when you brush or spontaneous bleeding of gums, it's good to seek advice from your dental practitioner as well as from the medical practitioner. If you have any questions, you can always drop me a message in the comment section, but that was my brief or a general explanation of the bleeding of gums. So goodbye for now, and thank you for watching, and you will see me in my next video. Thank you very much. Bye.